A scaled digital transformation needs three things or is driven by three imperatives, and all three have to be true for it to be a scaled transformation. The three principles are desirability, feasibility, and viability. If
Oh, I
these three
like that.
happen, then a transformation is successful.
Welcome to Embracing Digital Transformation, where we investigate effective change leveraging people, process, and technology. This is Darren Pulsford, Chief Solution Architect, author, and most importantly, your host. On today's episode, COVID, GenAI, and digital transformation in medicine with special guest Rajan Kohli, CEO of CitiusTech. Rajan, welcome to the show.
Thank you. Thank you for having me here, Darren.
Hey, I'm really excited about our topic today. It's a big topic, of course, digital transformation. The show is Embracing Digital Transformation. So to have a CEO come on and talk about their digital transformation and how you help others, this is going to be awesome. But before we dive in there, Rajan, every superhero has a background story. What's your background story?
Yeah, I'm certainly not a superhero. My background story, I would say I'm an engineer, MBA. I did engineering and very soon realized that I didn't want to spend my life developing code. Wanted to then do an MBA and go in towards the management side of business. Spent 28 years with a tech services firm, one firm. By the time I left that firm, I think of my batch of 220 who graduated from MBA, I was the only one still in the same job.
Oh,
So
wow.
I was the last man standing. Uh, in the 28 years, I did variety of roles, sales, business management, starting up new businesses within a large enterprise. And then I got this opportunity to be CEO, and I wanted to apply everything that I learned in the last 28 years to this particular job, and I'm loving it here.
So, I mean, what made you make that jump from a software engineer? Because that's where you started with software engineering, right?
Yeah, that's right.
So you just got tired of looking at the screen and typing, or what was it? What was it that made you want to jump to management, the dark side? Because I'm a software engineer, but I've been in management too, so I know. So what was the one thing that just said, I got to move into management?
It, honestly, it was my love for travel and meeting people and meeting clients. That's probably, it was more attraction to something rather than running away from something else. I just loved visiting new places, meeting new clients, and I felt I could do that, accomplish that more if I moved towards the management side rather than.
Well, yeah, that is very true. Yeah, absolutely. So we're very similar. I love traveling. I love meeting people. That's one of the reasons why I have the podcast. But hey, I mean, we can sit here and talk about travel all day, I'm sure. But before we do that, let's talk a little bit about digital transformation. You've
Yeah.
been in the industry a long time. Tell me about your company's vision of digital transformation, and also what have you gone through yourself as far as digital transformation?
Yeah, that's a very interesting question because people have been talking about digital transformation for at least 15 years. Could be even more, but at least 15 years. But the fundamentals of digital transformation actually haven't changed. A scaled digital transformation needs three things or is driven by three imperatives, and all three have to be true for it to be a scaled transformation. The three principles are desirability, feasibility, and viability. If
Oh, I
these three
like that.
happen, then a transformation is successful. Now let's take a look at our current context, and probably since CitiusTech really addresses healthcare industry, some of the examples I'll pick will be from healthcare, but I'm happy to speak outside healthcare also because healthcare is a follower, not a leader in digital transformation. So let's look at post-COVID, right? People got used to doing a little bit of remote care, remote health
A little
management.
bit, no, a lot.
For a while, that was the only way to do it, right?
Yeah, that's right. Yeah.
And then there's obviously cost pressure because providers were not making money out of their normal elective surgeries. So there is cost pressure on the providers. People were more open, or probably the only avenue was to do remote management. And technology was now available around edge computing, remote monitoring, report management. So when all these three things, the viability, the feasibility, and
Desirability.
desirability came together, now I feel this is going to be there. This is going to be a trend which will now really pick up. It's not going to be a fad that'll just go away. Right?
So I want to touch on this a little bit because before COVID hit, telehealth was feasible, it was viable, but you don't think that the desire was there as much.
No, because I always had other avenues as a patient, as a consumer, and sometimes certain changes which are fundamental require you to do those for a long period of time for them to become a habit.
Right, right,
Right now you'll see, right, of course, there was a time when 95% of interaction probably was remote. It's never going to be the same. Just like in retail, there was a huge jump. 27% of retail sale became online sales. Grocery sales
right.
become
Yeah, yeah, yeah.
it's come back, but it's not come back to the level that was pre-COVID. Right, it's settled somewhere in the middle. Similarly, I feel that the same will happen with remote patient care.
So I love that you identified these three things because I can really see it. And sometimes we need an external stimulus
Yeah.
to touch one of these three things. And with COVID, the desirability for telehealth was the thing. Do you see other digital transformations that um, COVID kind of fostered or drove, not around desirability, but around feasibility and viability?
Yeah, I would say give you one more good example. I think you'll recognize this. Post COVID, there has been a huge shortage of nurses and healthcare staff.
Yeah, yeah, there has. Yeah.
So there is that need, right? Secondly, now there is technology available through GenAI, which probably was not available 2 years back. So that's
That's
your
true.
feasibility, right? So technology is available, need is available. Now you will see a lot of solutions around automation of work that typically nurses do, reducing the overload on nurses and other healthcare staff so that they can spend more time with the patient, and we can reduce the gap between the staff that is available and the staff that is needed to give optimum service.
All right, folks, a quick breather here. In my time of working with tech company founders, I come to one important realization. Certain tools can truly be a game changer. That's why I'm excited to talk to you about Nasuni, an enterprise data platform for hybrid cloud environments that powers business growth with effortless scalability, built-in security, and fast edge performance. Nasuni consolidates network storage and backup, eliminating data silos without changing your apps or workflows. Clients love the easy setup, rapid file sharing between offices, and the ability to leverage detailed analytics that matter. Data fluidity from the unique way data is stored increases its value, providing support for future AI initiatives. Plus, the centralized management model frees up your IT team to focus on more strategic business objectives. Head to nasuni.com/embrace to see how it can revolutionize your data infrastructure today. All right, now back to the show. Interesting. In fact, what just came to my mind, and I want you to guess on this one because this is a big. Can you imagine if GenAI came out in 2019 instead of 2022? Could you
Yeah, it
imagine the difference that would have made in the growth of GenAI? I don't know how you could, but
no, but see, this is very important point that sometimes a technology has to ride another technology for it to then take us to the next level. In 2019, I don't think the industry had their data in place. Uh, they were not fully on cloud. So there is so much of the data and infrastructure that is available now that was not available 3 years or 4 years back. COVID enabled that movement. As Satya Nadella said,
Yeah.
this industry saw 3 years of transformation in 3 months. It was really getting access to the infrastructure which was remote, moving data to the cloud. A lot of that is enabling the push into Gen AI.
You just said something that I've never heard anyone say, which is COVID fostered or was a catalyst for Gen AI.
That's right.
Yeah, that's incredible when you think about it. Right.
Yes.
So if anyone's complaining about Gen AI, we can blame it on COVID.
Yeah, it's the cause and effect, and we should be very careful of what
Yes.
is cause and what is effect.
But I do think you're right there because without COVID, driving so many people to digitize, that was the desirability.
That's right.
Maybe Gen AI wouldn't have taken off as fast as it did in November of
Yeah.
2022.
Another factor why I feel Gen AI has taken into enterprise much faster is because consumers got exposed to Gen AI ahead of the enterprise. You and I were using ChatGPT in our daily life, asking all sorts of silly questions about vacations and other things. And when the enterprise brought that technology in, people already were very comfortable and had used it and found benefit in it. So you didn't have to explain to uh, the technology or business why this is good. You just had to adapt it, which is
Yeah, yeah, I think you're right. I think you have something there, right? Because yeah, we were using it. Now, are in healthcare? Are you seeing Gen AI used a lot? I mean, by doctors and nurses, probably, but institutional use of it.
no, institutional use. I'm actually surprised that healthcare is not lagging in this as far typically healthcare is probably lagging all industries, but certainly financial services, consumer retail, telecom, they're far ahead, right? But in this one they're not so far behind, and the reason being there are areas where Gen AI actually solves certain problems that were very hard to solve without Gen AI, because the biggest problem in healthcare is diversity of data. Data is in various
Yes.
shapes and forms. Healthcare is the only industry probably there are still faxes that are coming in.
Yes, there
So,
are,
right?
which is mind-boggling to me that people are still using fax machines, but that's what
Yeah.
happens.
And Gen AI is actually trying helping leapfrog some of these problems because it can read all formats of data. So Gen AI is being used in institutional forms. There are some examples where uh, it is it's going to have a big take. So, for example, as a patient, you want your health record to be summarized in a language that you can understand,
Right.
whereas the EHR is very templated, right? You and I probably cannot understand the language of the EHR. So patient summaries, right, are a very, very important part where it is very easy to use Gen AI to create those summaries. Now, clinical diagnosis, where obviously it's a huge potential, a lot of proof of concepts. There, I expect a lot of use, but in a more restrained manner, because you want to be absolutely careful of how and when this is used, right? Because the last thing you want is a wrong diagnosis, even though the doctor is eventually going to write off or sign off on any particular diagnosis.
So that brings up a good question on digital transformation. If we talk about the feasibility and viability, do I want, and there's desire too, do I want a Gen AI making diagnosis?
You
And
do.
if a doctor is like, yes, I want it to help me, how does the patient feel about that? It is feasible, but if a Gen AI is wrong, ultimately the risk could be high. So,
No, you are absolutely right, but you do want the Gen AI to be involved because a doctor with a Gen AI will always be better than a doctor without a Gen AI because uh, two reasons. One, in many countries, the patient to doctor ratio is
it's just
not
too
too
high.
high. It's just
Yeah.
too high, right? You need this tool available so that doctors can use their time better, right? Second, a lot of time, especially when you keep doing something again and again, there is a chance you may overlook certain things.
Right.
But Gen AI doesn't have the same problem. The more it looks at things, the better it gets.
The better it gets. Yeah.
So there is a good fitment, but obviously, still, if you become too dependent on something, then you just always take their answer as the best answer, and you may not apply your judgment. So there are things that we still need to put in place, but I think fundamentally, a doctor with Gen AI or a healthcare provider with Gen AI is going to be better than without.
I think so too. And I've had Dr. Blum on my show talking about this same thing. So there seems to be some consistency on the desire for this, but there's still some fear
Yeah.
around it. And the fear, I think, is primarily coming from lawyers and insurance companies and people that are afraid. I even think patients would feel very comfortable if a doctor, had a Gen AI that had all the knowledge of all the doctors in the world in it. Wouldn't that
Yeah.
be incredible, right? To say, hey, let's ask Gen AI to help with this diet. What tests should we run next? And what things am I maybe not know about? And are there other patients that are having similar things? It's very, very powerful. But I still 100% agree with you. It's an augmentation of the doctor, not a replacement. Let's talk a little bit more about the feasibility and viability aspect that you brought up. What can we do to increase the feasibility of digital transformation? Because let's say that I'm working with a company or I'm in my own company, right? And I have the desire for digital transformation, but how do I know about feasibility and viability? What are those aspects?
So very, very good point. Let me pick actually viability as the first
First, okay,
issue.
let's go with viability.
Actually, in healthcare, that is the problem area. So the reason innovation in healthcare does not scale actually comes down to viability, because a lot of time the incentives uh, among the various players are not connected or not the same. So, for example, your healthcare provider, right? They are linked to your employer, not provider, sorry, your healthcare insurer. They're linked
Yeah,
to your
insurance. Yeah.
employer. And in on average, you change your employer. Not me has changed it after 28 years, but um, on average, people change their employer every 3 years, right? So your payer is going to change every 3 years. While they have interest in your healthcare, they don't have a long-term interest in your healthcare, right? There's no lifetime value. We talk about preventive care, but really, I mean, if you're going to be with them for 3 years, they're more interested in how do they optimize those 3 years. So the incentives of the people in this value chain are not aligned. You are interested in long-term value of your own health, but the payer who's at the center of this value chain doesn't have the same interest. Now, government under Medicare has your long-term value, right? So hopefully they will solve for some of this, and you can already see certain actions they're taking. For example, controlling prices of drugs. So they're driving it because they have the ultimate payer under Medicare, so they have the long-term interest. But in the healthcare value chain, that is the problem area under value-based care, also under value-based care for commercial payers. and in many other areas where investment has to go in one area, but the benefit is not clear who will capture and how will that incentive flow back to the innovator is not very clear. So that is the biggest problem in healthcare
I
innovation.
think that's really interesting the way you pick that apart, because you would think that a doctor or a medical institution would want would be the highest concern for the patient, but it's not. It's the insurance company, which is the wrong thing, right? Because what you really want is you want a doctor that says, "My job is to keep the patient healthy instead of treat them for bad things." Right? So the incentives are all mixed up. So I understand the viability on here is an issue, but it's a
Yeah.
systemic problem. It sounds like it's not something I can easily just fix
Not
as a
not
healthcare
easily.
provider.
Not easily, but under value-based care, there are obviously several initiatives, but it's not easy, but it is getting solved. Now coming to feasibility, right? I
Okay.
think feasibility is I think easier problem to solve because as I explained, technology is available. But what is available today? Let me give you an example I was thinking about. Uh, Without electricity, there would not be any invention of electric bulb, I'm guessing.
Yeah.
If
No,
there was
that's
no
true.
So I would like us to look at GenAI as that electricity. It's actually a fundamental infrastructure,
Yeah, I agree.
right? Uh, but a lot of people are using it as a use case and then trying to see whether there is a value in this use case, a value in that use case.
Yeah.
But if you look at use cases individually, probably they may not get you the right value or the right justification. But if you put GenAI capability, which means invest in data, get all the data in place, and then apply a more holistic use case, which is more end to end, you'll see tremendous value. And we may identify things that we don't know today, right? So, but a lot of our clients are still, because they don't have the full picture, the good ones are looking at it as end to end capability, but many are looking at it as proof of concepts.
As proof points. Now, I like how you said that it's like electricity, because the other analogy I've used is it's like email. And if someone says, "Well, what are the use cases for me to use email?" And I'm like, "Infinite." I mean, come on. And so, but I like the electricity one even better, because
Yeah,
Gen AI is going to create a whole bunch of new types of products and new ways of dealing with data or dealing with day to day life that we've never even thought of before.
correct, correct. And it will lead to, I mean, obviously in other industries, there will be several impacts, and the impacts are always one or two, uh, you know, distances or hops, if you take. So, for example, if you have an autonomous car, right, what's the impact of that on the insurance companies? Of course, because if you have autonomous cars, you are going to buy less cars. If you buy less cars, you need to insure less cars. So it's not just the auto companies, but there's many other second hop impacts, which may be even bigger than the first hop, right? There are no parking spaces required. So what are they going to do?
So this is really interesting, because digital transformation, to you, the technology is the feasibility aspect.
That's right.
That's a small part.
That's
It's the
that's
desirability and the viability that are the bigger aspects of things that will impede digital transformation in an organization.
Yeah, absolutely. And desirability is being driven now because as a patient, we all know our healthcare is not the best industry from a patient experience point of view. You buy on Amazon, it knows you very well, right?
Oh yeah, it knows me better than my doctor does.
Yeah, absolutely. On Facebook, within 6 likes, they know you very well, better than your spouse does.
That's
So
true too.
that's the benchmark that this industry now has, right? So people are comparing the best of experience, not in what they get from another provider versus this provider, but what they get from others outside of this industry. So there is desirability, there is feasibility because technology is available to all industries. We
But
have
the
to look for
viability is the issue here for healthcare.
viability. Who spends? Who
Yeah.
gets the incentive? What is the incentive?
So I already see some I see some changes in the healthcare industry in specifically that can bring all three of these together. And like concierge doctors, for example, I've started to see this emerge where you subscribe to a service and and it doesn't cost you to go visit the doctor, but you pay a monthly fee. And the
Yeah.
benefit of that is that doctor doesn't want you in his office. He wants you healthy. So his whole motivator is completely different. And the insurance
But
is not even involved at all because insurance isn't
yes,
taken there. So that's
yes, that is the
that's
point, right?
changing the
Insurance
industry.
is not involved. That means that doctor is a concierge help to you. It's not replacing anybody else.
That's
So there's a
correct.
limit to what that can do because the insurance will not acknowledge that as a doctor because they want to make sure there is a certified doctor
Yeah,
involved.
but they are certified doctors. I'm sorry. And in fact, our primary care physician just recently said, "I'm done. I am done with dealing with." She was in a group at a major healthcare organization. She says, "I'm done with it. I'm not allowed to take care of my patients the way I think is best." So
Yeah,
her and three other doctors left and formed their own concierge. So now you pay them yearly, and you still have to carry insurance, but they don't have to follow the rules of the insurance. Only if you need
interesting.
procedures, then they say, "All right, I'm going to refer you to a specialist or whatever the
That's
case
what I
may
meant.
be."
Okay, that makes sense because you have to then be referred to another doctor who will then
Yeah,
do
yeah,
that.
exactly. So what I think the only reason I brought that up is because this viability aspect, not just in healthcare, but in other organizations,
That is true.
is institutionalized a lot of time, right? So there's a lot of institutional bureaucracy and processes and things that are there. So sometimes for digital transformation, we need a disruptor in that aspect. And that's what we saw with COVID. It disrupted the viability of having to go into the doctor. And now doctors are like going, well, I don't want to get COVID from you, so I'll just talk to you on the phone, or or completely disrupting an industry by 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 circumventing the bureaucracies that have been established over time.
Yeah.
So this is
You
an
know,
interesting concept.
another interesting is work from home.
Oh yeah,
Who
now tell me about this one.
who
Yeah,
allowed work from home 4 years back, right? But we had no option, and then we got used to it, and then it worked. Of course, now some people are coming back uh, partially, some people full time, but that's which is
so
also good. You don't want to be 100% work from home, but even partial work from home was never going to be allowed at this scale.
and now it is. But here's a good question, because we just saw in the news this week. um, I think it was Amazon that said you have to be in the office 5 days a week now. So
Yeah,
do you think that CEOs, because you're a CEO, and that are mandating this, do you think that they're trying to? Why are they doing it? And does that include some digital transformation? Because maybe they've lost control of their
yeah.
workforce, or maybe they're afraid their workforce is not being efficient as they used to be. What do you think the driver is behind that?
So in this particular case, I think the reason given was that they want to relook at the number of layers and delayer or something to that effect. I don't know if that's true or that was just said, but I believe that is what was said.
But what about for you, for your
Yeah. So for us,
organization?
hybrid is the way. I definitely believe that you need some minimum time in office because there are things that you can do in office that you cannot do at home. The team bonding, innovation, think innovative
Oh,
thinking,
absolutely.
uh, you know, just tapping people on the shoulder, water cooler conversation. These cannot happen. The informal culture building that you do in an organization, that really cannot happen if you don't have work from home. But do we really need people to come 5 days a week, at least for us? Because vast majority of people are in India, and if you've been to India, you know that infrastructure in certain cities is not good enough, and people spend hour and a half on the road, which they can actually work for the client, and I'm happy with that. So, yeah, I'm all for hybrid.
No, I agree with you there. Hey, Rajan, this has been a fascinating conversation. And I love no one's ever brought up the three ilities, right? Desirability, feasibility, and viability in digital transformation. I've never heard it positioned that way. So I love it. And this has been very insightful for me, and I'm sure for my audience as well. So if people want to find out more about what you guys do, where can they find out more information?
CitiusTech.com. We have all the information there. We are 100% in healthcare. Tech services firm focus on healthcare. So our engineers are as proud about their tech chops as they are about their healthcare chops.
That's awesome.
So if you use the word utilization management with our engineer, they actually know what it means in the healthcare context and not what it means in a context of a server or a resource use. So yeah, CitiusTech.com, and would be very happy. And it's been very engaging conversation, Darren. Loved talking to you. Thank you for having me.
Hey, thanks for coming on the show. I sure appreciate it. Thank you for listening to Embracing Digital Transformation today. If you enjoyed our podcast, give it 5 stars on your favorite podcasting site or YouTube channel. You can find out more information about Embracing Digital Transformation at embracingdigital.org. Until next time, go out and embrace the digital revolution.